Hi, I'm Dr. Alok Patil, orthopedic robotic joint replacement surgeon and sports medicine specialist. So here today I would like to discuss you about one case which we are going to operate today. So this is a patient, 60-year-old female who is having bilateral advanced osteoarthritis. So I have examined her and there is a lot of limitation of motion, lot of tenderness, medial joint tenderness, and she's having patellofemoral arthritis as well. So she's unable to walk on her leg, and now presently she's having waddling gait, that is limp and lurch on the affected limb. So she is having that sort of gait and she is unable to walk and do any of her activities. So looking at her x-ray, so this is her right knee joint x-ray and this is a left knee joint x-ray. As you can see, there are two bones. One is the thigh bone and one is the shin bone. So as you can see, between both the bones, you can see there is some space over here. Whereas over here, there is bone on bone completely. It is completely attached. And because of the frictions and all, we can see plenty of osteophytes in and around the knee joint. So this is completely advanced osteoarthritis. This is of the right knee and this is of the left knee. This is a thigh bone and this is a shin bone. And you can see there is some amount of space here, and over here you can see it's bone on bone, completely attached. So there is no space at all. So once there is bone and bone, there will be definitely loss of cartilage and there will be a lot of osteophytes, that is bony outgrowths because of friction. And moreover, her meniscus will be degenerated and ligaments also worn out. So for such patients, we give a terminal and absolute treatment, that is joint replacement surgery. So in joint replacement surgery, what we do is, the whole damaged knee, what we do is, we replace it with a metal implant. This is a metal implant. By balancing or taking minimal bone cuts, we put the metal implant over here, femoral component we call it, and this is the tibial component which has a tibial tray. So this goes in the shin bone. So in between there will be the plastic, so there will be normal movement and pain-free movement for the rest of the life. As in today's era, we are very much blessed to have advancements, and nowadays we have started with robotic joint replacement surgeries. So what do you mean by robotic joint replacement? Robotic, it's a modern and most advanced type of joint replacement surgery in which a surgeon operates and the robot guides the surgeon in a smarter way. By doing so, we get a very precise, we get a very good precision, very good outcome, less pain, and moreover, the overall outcome of the patient is very good. So Adarsh Hospital, by the blessings of all our trusted patients, we are the first one to have a fully automated robotic system in the entire Kalyan Karnataka region, and in fact the entire North Karnataka. So the main aim of getting this robotic equipment so that the patient don't have to travel far to the metro cities, and which causes them financial burden as well as their personal burden as well. So in less than 1/3 cost, we are offering this service at their doorsteps. So with this robotic surgery, it has a lot of advantage. So prior to 1 month, even I was doing more than 5,000 joints conventionally. But today, after operating since last 1 month, I see a lot of difference between conventional as well as the robotic. In conventional, we used to use the metal blocks, and manually with the saw we used to take cuts. If the gap balancing is not accurate, then again we used to retake the cuts. So in that way, there is a lot of bone loss, lot of soft tissue handling, lot of blood loss, and overall the accuracy and the result also matters. But in case of robotic surgery, the precision is top notch. And pre-operative itself, now since the x-rays we have taken, we can see this patient, there is bone on bone, lot of deformity. She is having varus deformity with waddling gait. So pre-operatively we take a CT scan of such patients, 3D CT scan, and pre-operatively we run the program and we check for the extent of bone loss and how much cuts we have to take. So Pre-operatively, the size of the implant is decided, how much bone we are supposed to resect, how much ligament we are supposed to be handling. So these are all we know before going to the operation theater. So after getting all this data, then intraoperatively we expose, and accordingly we make use of the robot. And intraoperatively we have that we play along with it. I mean, we can check for the gaps, and accordingly the robot takes precise cuts, and minimal soft tissue handling is being done, and very less blood loss. So by doing so, there is excellent fit of the implant, and because of the excellent fit and more natural fit, the longevity of the implant also increases. So supposedly one implant can last about 20-25 years. So with the robotic surgery and with such a precision, the life can again the 10 years to it can be added. The patient post-operatively will be requiring less analgesia. That is, the patient won't be having much of pain, and they will be mobile since day one. We will be able to make them bend their knee, make them walk for a few steps on day one, and slowly they will improve by day 2, day 3. Hospital stay is somewhere around 3 to 5 days, and they will return to active life with proper execution of physiotherapy, exercise, and they'll be back on their feet by active life. In today's world, robotic surgery is a game changer because the precision level which it offers extremely very appreciable, and definitely it is very helpful to the patient as the outcome matters with the minimalistic blood loss, less pain, early return to work. So such kind of services, I think so the people of this region, we have brought it to their doorsteps. And also we are not charging for any robotic surgery expenses. It is all free of cost. Only whatever the conventional charges we have been charging for past 7 years, we are doing the same thing by offering, but extra added by offering robotic surgery. We are giving this offer to the people of this region, so that even they feel privileged to have such surgery. It is not that only the privileged ones who can go to the metro big cities and get operated. Such services I want to offer to the people of this region with free of cost. So I hope everybody whoever is in need can come here, get their knee joint evaluated. Do not ignore whatsoever, do not ignore any pain. If at all it is not subsiding within 3-4 days, don't think of just taking painkiller, because by treating symptoms you're not treating the cause, and I believe that painkiller is not the solution. Whatever it is underneath, we will thoroughly investigate and come to the diagnosis, and we try to treat the cause. By doing so, one should make use of it, and any sort of knee pain, don't think that we have to live by it for the rest of the life. There is appropriate treatment, maybe surgical, non-surgical. There is always a treatment, and better get evaluated by the specialist, and it will definitely make a difference, and sooner the better, and you will be able to save your knee. And most importantly, this is not just about the surgery, it is about the patient being active, being pain-free, and living his life to the fullest. That is the main motto and goal that I as orthopedic and joint replacement surgeon have. Thank you.